Now, a new bill out of New York allows minors in the state to consent to certain medical services without asking for parental consent, raising the ire of many parents' rights advocates. New York Assembly Bill A6761 allows doctors to provide certain medical, dental, hospital services and immunizations without that parental consent.
The bill states that anyone who comprehends the need for nature of and the reasonably foreseeable risks and benefits involved in any alternatives may give effective consent to such services for themselves, and the consent of no other person shall be necessary. Now, the part that was excluded from the coverage of this is that it's specifically in the bill, it cuts out the first word of the one sentence of the one sentence bill, which is that it's for homeless use. So the idea is, I think people who don't have anyone to consent for them, can they say, yes, I broke my arm and I need surgery, yes, I need a vaccine, whatever, and not be precluded from necessary medical treatment simply because there is no guardian around that has custody over them.
Yeah, in that case, I think obviously I wouldn't have any problem with someone not needing permission for a guardian or parental figure that does not exist. I don't, particularly want. I want to let people make their own medical decisions. I mean, there is, an issue for in the case where a underage person, a child, wants to consent to some medical thing or an immunization, and the parents don't. What should be done? This is just like a legitimate disagreement, and it's a hard question to ask. I tend to think, again, I don't care if the child wants something and the parents are okay with it and a doctor wants to prescribe it or do it or whatever it is, it's really none of my business. I don't care. When there's a conflict among one of those three entities, look, there's just no easy way to answer this, frankly.
Yeah, I mean, there have been a number of cases that have divided the public along very mixed ideological lines. Yeah. There were stories about parents who had, because of either their religious beliefs or certain health practices, feeding their kids diets that weren't medically indicated that made the kids sick, or not wanting to have certain medical interventions because they didn't believe in traditional medicine, and children have gotten sick and perished because of some of these parental choices. So obviously it's not the case that every parental choice is a good one. Of course, this cuts the other way when we're talking about issues related to trans rights, where so many conservatives are frustrated about what they perceive to be not medically indicated interventions on the behalf of the child, where parents think, and the child obviously thinks, that their mental health would be benefited from some of these interventions.
Right. I've also written about, research, edited in my role at Reason Magazine, so many CPS cases that have made me very wary of getting the state more involved in parenting, even frankly in cases where the parents are not very good, or they're overworked because they're low income and they have to work many jobs and they have too many children and it's a bad situation. Even when kids are not getting ideal care or there is some abuse, the intervention of CPS often makes the situation so much worse. And also I've seen, tons of cases where there's so many, for, medical reasons. Some doctor says, or that like the child abuse specialist gets called and says that a young kid was abused, that it's a total pseudoscience. And people have lost their kids for utterly fanciful, made-up reasons. It happens all the time. It's really scary stuff.
Yeah, there's a lot of critique of CPS that I think is very legitimate, and particularly people I know in the Black community who feel like the program is weaponized, in particular against Black families, in separating kids from their parents. So
I know statistics on that are insane. It's like 1 in 4 Black families are visited by CPS.
Yeah, it's crazy. It's a real issue that I heard about, frankly, from constituents on the campaign trail when I was working for Bernie Sanders back in 2020. That's a real thing. So this is an interesting question about whether or not, I'm not exactly sure what happens to kids without guardians when they do need a medical intervention. Is it that they fall into state custody? Is that a hurdle that takes time and causes them to have medical delays that aren't good for their outcomes? Is it requiring there to be more of a custodial relationship between the kid and the parent that is maybe advised, given what we've just talked about, and having a law that allowed for simple treatment without that relationship being established or reestablished? Is that a boon? I don't know. But it's the reason this came into my attention is because there are people who are concerned this will be read more broadly and allow any kid, regardless of circumstances, even though that's not what the short, brief language of the proposed bill says, but are afraid that this is some sign that there is a loosening of parental inclusion in decisions that affect a child.
I mean, you in the comments, viewers, tell us what you think about this. Like, imagine a situation where parents want maybe their teenager want their parents to get the COVID vaccine. The teenager, maybe they've watched our show, seen some of our guests. They're a little bit worried about whether it's necessary and the side effects, and they don't want to do it. Should they be compelled, from a parent's rights perspective, should they be compelled to have the kid do it? I don't know.
And once you answer that question, ask yourself the reverse question.
Right.
If a kid really wants to get vaccinated and their parents, because they watch this show or others, decide that they don't want to get their kid vaccinated,
should they be able to do it?
Yeah.
Yeah, it's a hard question to answer. Also, though, the American Red Cross now asking blood donors if they've ever received the COVID-19 vaccine and instructing those who answered yes to call a number to determine whether they're still eligible to donate blood. So this appeared online the other day, and some were seeing it as an admission. There's something wrong with the vaccines, including RFK Jr., of course, presidential candidate, who commented on X, the propaganda is beginning to unravel. However, a community note under this initial post provided some pushback. The Red Cross apparently asked this question to make sure you haven't received a self-replicating vaccine, and if you have, there's a 2-week wait. Now, most COVID vaccines are not self-replicating, do not require a waiting period. I thought this was all pretty unclear, so I actually just went to the Red Cross website to check. They say that it seems like the overwhelming majority of people who got COVID vaccines don't need to wait or defer or do anything. That whatever the
replicating
the term is a little confusing, but basically this means R&R, Moderna, Pfizer, even J&J here, AstraZeneca, all of those vaccines. If you were vaccinated with one of those, you don't have to wait. You can give blood. If you received it from a vaccine not listed there, or I guess you don't know what vaccine you received, then you should wait 2 weeks before giving blood. So it's not quite the the mask off, the vaccines are killing people, your blood is tainted, we don't want it, I think some people were making it out to be.
It's also true that the Red Cross, the blood donation is carried out with an abundance of caution given mistakes that were made in the past. Many LGBT advocates are still frustrated that there are these prohibitions against giving blood if you've had gay sex in the recent however many year, basically, even though now they're tested anyway. Obviously, there are people who aren't gay that can have HIV. It does seem it's an anachronistic rule from a different time that is perhaps continuing on a certain kind of prejudice. But those rules were put into effect because there were really terrible mistakes that were made in decades past, and it does seem like these kind of rules. They could indicate, oh my gosh, is there a real problem with this type of vaccine? Or it could just indicate that this is a very cautious area of medicine and they're just going above and beyond.
Makes sense. All right, that does it for us for today. Tomorrow we'll be back with more Rising. Please tune in then.
Be sure to like, share, and subscribe so you never miss any content. And for those of you who like to listen while you're on the go, we're now available anywhere you listen to podcasts.
See you later.
Take care.